Now, the DREAMS project is an ambitious public-private partnership aimed at reducing rates of HIV among adolescent girls and young women in the highest HIV burden countries. Molisa Manyando, USAID's project management specialist, in discussion with Ashwin, shares more on the initiative in the following interview. Let's have a look.
You are with Africa Good Morning, and with me is the USAID Project Management Specialist, Ms. Molisa Manyando. Good morning, Ms. Manyando. How are you?
I'm fine, thanks, Ashwin. How are you?
I'm all right. So we're going to be talking about dreams, but not the type that you have when you're sleeping. It's a completely different thing with USAID. What is dreams? What does the acronym stand for?
Thank you for the question. So DREAMS stands for Determined, Resilient, Empowered, AIDS-free, safe, mentored and safe adolescent girls and young women. It is a PEPFAR program that has been being implemented by USAID here in Namibia. We are currently working in 9 districts and planning to expand to 2 additional districts in 2023. So the goal of DREAMS is to avert new HIV infections in adolescent girls aged 10 to 24 years old. And we currently work with government ministries as well on our DREAMS project. And the reason why DREAMS is also being implemented, is the realization that there is a 7% HIV new infections in the adolescent girls and young women. So this is why it's such a critical project.
All right. So what approach does DREAMS use?
So DREAMS delivers a package of services. We tend to say it's a layered of services. When a young girl is given this layered of services, they remain HIV, they remain free from HIV risk. And the services that are being implemented include HIV and GBV prevention. There's skills building. There's also access to reproductive and sexual health, access to HIV testing, and we also provide pre-exposure prophylaxis, which is commonly known as PrEP. And PrEP, I'm sure you're aware, it's putting HIV negative people on using antiretroviral so that they remain HIV negative. Yes. And there's also GBV education that is provided. But also what DREAMS also does is the realization that these adolescent girls and young women are part of a community. So it's also trying to address the contextual issues within the communities where they found themselves by working with the parents and the families of these adolescent girls and young women, and also addressing and working with male sexual partners of these girls. So for male sexual partners, it's not necessarily the actual male sexual partner, but it's working with men that are characterized through the identification from the girls, because we do ask them to say, who are your male sexual partners? There was a formative assessment that was done, so they had identified several types of men. So it's addressing them using gender norms training and GBV HIV prevention, and also ensuring that we are also linking them to HIV testing, to PrEP as well, provision of condoms, and also referral to voluntary medical male circumcision.
All right. I mean, truly essential work, Ms. Manyando. So does DREAMS exist in any other countries being implemented elsewhere, and why were these countries chosen?
Yeah, so DREAMS, like I said, it's a PEPFAR program. So it does exist in 15 of the sub-Saharan African countries, including Haiti. Haiti is not in Africa. Yes. Yeah, so the 14 are in Africa. That includes Namibia. And some of the countries, I'll just mention, maybe our neighbors include Botswana, include Zambia, Zimbabwe, Lesotho, Eswatini, Swaziland. And there's also Kenya and Tanzania, in South Sudan and Cote d'Ivoire. So that's where DREAMS is being implemented. And these countries were selected based on new HIV rates and HIV prevalence rates for adolescent girls and young women in these specific countries.
All right. Okay, well, bring it back to Namibia,
Yeah.
who are your project managers in Namibia, and how do you identify them, so to speak?
Thank you. So currently our civil society implementing partners are Project Hope Namibia and Achieve. And we also have other partners that are working with Project Hope and Achieve, including Catholic AIDS Action, including Intra Health Namibia. We have NAST, we have Lifeline Childline, and we've got Staff for Life. So these are the local partners that are working on dreams. And also currently we have a newer ministry partner through the Ministry of Youth and Sport that is also implementing dreams, and this is because of their mandate for targeting young people, and also the mandate to provide economic strengthening and financial literacy for young people. So that ministry is also a dreams partner.
Okay.
But we also partner and collaborate with Ministry of Health, and Ministry of Gender, and Ministry of Education. And I should say that, you know, the packages and the curriculum that we use in dreams, even the service provision, you know, it is government mandated. We use government curriculum when we are implementing dreams. And how they are selected, it's usually a competitive process, and it can be either global or local. So USAID will put a request for proposal, and organizations will apply through a proposal, and that's how they get to be recruited.
All right. Now, speaking of the work of Dreams itself, how many young women would you estimate have benefited from the program?
Thank you. So annually, Dreams reaches about 70,000 adolescent girls and young women that will receive this layered service package. And we do this through peer support groups, and also through the male champions, you know, and also the family a program that we also offer. I think for that we also meet over 10,000 parents, and including male.
It's quite a holistic approach. It really targets each sector of the community.
Exactly.
Now, Dreams has been in existence for about 8 years. Since then, what would you say are your proudest accomplishments?
Yeah, maybe about 5 years in Namibia.
About 5 years in Namibia, but okay, it's also all right.
About 5 years. So some of the key accomplishments include over 17,000 adolescent girls and young women have started taking PrEP. This is after they've been assessed for HIV risk. We've also seen or met 13,000 adolescent girls that have received critical GBV prevention services. And over 400 adolescent girls and young women have been trained as mentors for the Dreams project, and these young women have gone on to be employed into the project. And the mentors are also role models for the adolescent girls and young women that they work with, but they are also future leaders in their communities.
Yes.
And we've also seen about 14,600 adolescent girls that have been supported to attend school. And this also includes those girls that have dropped out of school, taking them back into school. It also includes a provision of STEM, science, technology, and
subjects,
So to ensure that for those girls that are either doing NAMCO or they're in grade 12, that they proceed to secondary school, because ultimately we want all the girls to complete school.
Yes.
And we also have about 425 young women that have supported to complete vocational school.
Right.
And among those, we have about 347 that we have linked to paid paid internship, including job placements. So what we do with the vocational training is that once a girl has completed their vocational school, we give them, if they were doing joinery, for instance, or they did welding, so we will give them what we call a starter pack. So a starter pack would include the necessary tools
yes.
that she needs to be able to do her work,
yes.
which includes, the toolbox, if and the security or the overalls. I didn't want to call them overalls.
Overalls, yes, yes.
Yes.
But yeah, I hear you.
Yeah, to make sure that when she gets out there, she is ready.
She's equipped.
She's equipped.
I do have to say it's admirable that you are concerned with every stage of these girls' progression. Thank you very much for joining us on Africa Good Morning.
Thank you for having us.
All right, so I've been talking to Ms. Molisa Manyando, who is the USAID Project Management Specialist, about DREAMS. Could you just say the acronym once more? DREAMS stands for? Determined. Resilient.
Empowered. AIDS-free. Mentored and safe.
Mentored and safe. Once again, thank you for joining us.
Thank you so much for having me.
This is still Africa Good Morning.